Good morning, everybody. Welcome to this question and answer session hosted by Care and Support West. My name's Angela Roberts. I'm the Deputy CEO of Care and Support West. I'd like to ask the other people on the call to introduce themselves. Mike, if you'd like to go first.
Hi, my name is Mike Thomson. I'm a litigation executive at Royds Withy King solicitors. I advise on employment law matters and also immigration law matters.
Thank you. Sam.
Hello, I'm Sam Hawker. I'm Managing Director at Ablecare Homes, and I'm on the Care and Support West board, acting as Secretary and Vice Chair.
Thank you. And Rizwan.
Hi everyone, good morning. My name is Rizwan. I'm a Director at Solomon Care, and Solomon Care owns a 31-bed care home, Tilsley House in Weston-super-Mare.
And you're also on the board at Care and Support West. I
am, yes indeed.
Yeah. Okay, thank you. Right, it's a short session. Mike, I'd like to invite you to talk us through a summary of the EU transition scheme and the highlights for us. Thank you.
Okay, no problem. Following Brexit in 2016, which feels like a lifetime ago now, we've known there'd be a new immigration system in the UK. It's very much at the sort of the forefront of the government's agenda. And that's finally now been announced and to an extent implemented. And so there's two main changes under the new system, which is the position for EEA nationals. So that's EU nationals plus a couple of other countries like Iceland, Norway and Switzerland. And the replacement of the current Tier 2 general route into working in the UK. And that's been replaced with the new skilled worker route. Many of the immigration routes to the UK will be similar or even the same as part of the new system. So hopefully it won't be too confusing. So the biggest change we'll see is the end of free movement for EEA nationals. So whilst the UK was part of the EU, EEA nationals have been able to live and work in the UK with very few restrictions. They've also been able to bring their family members with them who can also work in the UK. This continued post-Brexit, but will end at precisely 11 p.m. on the 31st of December this year. So the settled status scheme was introduced last year to allow EEA nationals to continue to live and work in the UK. If an individual has been in the UK for at least 5 years, then they'll usually qualify for settled status. If they've been in the UK for less than 5 years, then they'll usually qualify for pre-settled status. Pre-settled status is essentially the same as settled status. It just allows them to stay in the UK for up to those 5 years and then apply for settled status after that. Any EEA nationals and their family members who arrive in the UK before that cut-off of 11 p.m. on the 31st of December will be able to apply for settled status. Any EEA nationals who arrive after the cutoff will fall under the new immigration system and will need to qualify for a visa in the same way as people from outside of the EEA in the way that they do now. So an application for settled status then needs to be made by the 30th of June 2021. So they've got a bit of time after they come to the UK to actually make that application. At the moment, in relation to right to work checks, so from an employer's perspective, checking the passport of an EEA national in line with requirements, the existing requirements of a right to work check will be sufficient to show an indefinite right to work in the UK. And that's not going to change until at least the 30th of June. So that's the window of time to apply for settled status. There hasn't actually been any further guidance yet on how that might change after the 30th of June, but we expect some more information to come out in the not too distant future. So just sort of a quick word of advice really on that then is just to let your employees know about those deadlines. So the 31st of December and then the 30th of June, probably more importantly for people who have already got EEA nationals working for them, just to make sure that they're getting those settled status applications in and what they need to do once that's been granted. So a very, very brief overview on the new immigration system. So the Home Office has said that it's streamlining and simplifying the process, which will reduce the time that it takes to bring a migrant into the country. The plan is that that simplification will counterbalance the fact that a large number of people will now need a visa to work here compared to previously. This will be managed mostly by the skilled worker route. So the current system is called the Tier 2 system. That's actually changed to skilled worker route on the 1st of December. It's a points-based system, and changes have been made to the requirements to make it a bit easier for migrants to come and work here. So, for example, the required skill level is going to be reduced from RQF level 6 to level 3, which is equivalent to A level, which will mean more roles will be available. The minimum salary threshold is being reduced, and the salary for a role can be reduced further when you trade points, but it can never be lower than £20,480 per annum. The changes, to be fair though, aren't going to be particularly helpful to the social care sector due to those salary requirements and the fact that the government hasn't introduced any real concessions for the sector despite the significant number of outstanding vacancies at the moment. So that was a very, very quick overview of those changes, and I will be happy to take any questions.
Thank you, Mike. It's quite a lot to take on board, isn't it? Especially as care providers this year have had one or two other things on their mind.
Yeah, of course, of course.
It was Sam actually who came to me and said, I'm really concerned about this with so much going on with COVID. I think many of us may have taken our eye off this particular ball, which is why we got in touch with RWK as our commercial partners on legal matters. So thank you. Rizwan, would you like to lead off with your first question for Mike?
Thank you, Angela, and thank you, Mike, for that summary. There's a lot of information, and as Angela says, I think that we've probably not given this as much attention as we have other pressing matters, as you can imagine. There's a lot of information that you've given, and I just thought, and you've covered, I think, a couple of the questions I was going to ask, but it may be worth just reinforcing the messages again. So we in this economy, in the UK economy, are reliant on staff from the EU. So just reiterate, if you would, for us, what their visa status will be come January the 1st for those members of staff who are already here and working with us.
Okay, yeah, no problem. So as I said before, so EEA nationals, so that's EU countries plus Norway, Iceland, Switzerland, who are in the UK before, it is a very specific deadline of 11 PM on the 31st of December, but hopefully people won't be arriving at 10:59. We'll be able to live and work in the UK without needing a visa. They need to apply for settled status, which they can do online. It's I understand it's a fairly straightforward process. It's a personal application that needs to be done by the individual, so it's not something that the employer can do or can help with. So they can apply now. The scheme's been operating for some time, but they have until the 30th of June next year. So they've got a bit of time once they get to the UK to do it, or if they're already in the UK, probably give them a nudge just to see if they've actually done that and make sure that everything's okay. We would advise just getting it done sooner rather than later instead of leaving it to the last minute, because it can take a bit of time to grant, I think. So, but at the same time, I don't think there's any sort of massive urgency on that. Conversely, overseas workers from outside the EEA already will need a visa in the way that they currently do, and that's not changing.
Thank you, and I'm sure that many of us will breathe a sigh of relief to hear all of that, Mike. And can you just also just reiterate the procedure, the process for workers in areas where there is a skill shortage in this country, and I think nurses come to mind specifically in our sector.
Sure, yeah, no problem at all. So there is currently a shortage occupation list in place already as part of the previous system that is going to remain in place, and nurses are on that list. There's been recommendations to expand the shortage occupation list to include some other key roles, some in the care sector as well, such as senior carers and home managers. But the government has actually rejected those recommendations, hopefully for now, not permanently, but that remains to be seen. And that's I think what they're indicating is that they just want to sort of roll out the new system now and take another look at it once it's all bedded in a little bit.
Thank you, Mike. I'll pass you on to Sam now.
Hi, Mike. Thank you for that so far. That's really helpful to know. I've got some more questions around some of the specifics that I've sort of just seen in the headline news stories on this that I wonder if we could just have a look at. And first of all, I was wanting to talk about the pay cap limit for this, which I've read was going to be 25,600, and you've just mentioned could reduce to 20,480 traded against the point system. So looking at the 25,600, that works out at roughly about £14 an hour. When you think in our sector, a lot of care workers are earning between the living wage of £8.72 and the real living wage of £9.50. How does that sit with us, and what can we do? How can we go ahead trying to employ somebody who's not from the UK?
That's a great question, and to be honest, it's a difficult one to answer. There are a specific list of job titles that are allowed to be recruited from overseas, and care assistant and sort of the lower ranks of the sector. It isn't on that list, and it never has been, to be completely honest. Nurses are on the shortage occupation list, and so their salary can actually be less than 25,600. They've got separate rules for nurses, confusingly, that aren't changing helpfully. But their salary needs to be compared to NHS banding, as opposed to the 25,600 and the 20,480. Although, regardless, I don't think it can drop below that under the new system.
Okay, thank you for clarifying that. I just wonder, leading on from all of that, in all of the information you've seen, which is probably loads of in-depth things that you've read through, have the government actually made any comment anywhere about the fragile state of the workforce and the market for social care? Have they carried out any sort of impact assessment that's going to affect you, like the EU nationals not being able to come and take jobs in our sector?
To be honest, I've not seen anything like that. The Migrant Authority Advisory Committee has done that for the government. They basically have put out a load of recommendations as to how this may impact and how it might work against the already struggling sector. Historically, it's been against adding social care roles to the shortage occupation list, but in its latest advice, it did actually recommend that it should add the senior care worker and some managerial roles. We've been calling for this, and I know the sector's been calling for this for a long time. So it's incredibly frustrating that the government isn't willing to follow this guidance at this stage, which historically it usually just implements those recommendations. It's clear it wants UK workers to fill the posts, fill all these outstanding posts, despite the fact there is not demand from the UK workforce. There's no one really seems to be applying for them, or at least not in the numbers that the sector needs. So even with the current rules, there are 100,000 vacancies in the sector. So there's no real explanation for the government's position other than it's purely political. It's well documented that Priti Patel is very tough on migration.
Thank you. Not really going to help a lot of us in social care there, but we just need to keep campaigning, I guess. Yeah. So although that's not great news for everybody, and those of us who do have shortages in care workers, sounds like things might be difficult. If we are an employer who is looking to recruit nurses, Can you tell us a bit about the how that process would work? You know, how do we go about the sponsorship license and getting ourselves in a position that we can recruit?
Sure. So employers need to apply for a sponsor license, and that can be done through the Home Office website. Once that's granted, I mean, although the government has said that it's been a simplified process, and it has to some extent, it's still not completely straightforward. But once you get that, you'll be able to sponsor migrants through that license, which will allow them to come and work for you in the UK. Okay,
and what are the cost implications of getting a sponsorship license? And also, can you tell me how long it lasts for? Is it a process that needs renewal?
Sure. So yeah, I'll start with the sort of cost and time, and I'll answer on how long it lasts for. So if you want to apply for the license yourself, then I mean, it is possible. The guidance note on it, which I advise on quite regularly on how to do it, is really detailed, and it's frankly is quite complicated. So it could take a while to get to grips with. I know when I first started doing these, it took me quite a while to really get my head around everything that needs to be sorted. So there's a number of supporting documents that you need to provide with your application, such as accounts and registration with HMRC. I mean, there's quite a long list of optional ones, but you need to have a certain number of those collated. So and then you also need to provide an application, a written application, basically setting out why the organisation needs a sponsor license, identifying the roles that you're looking to hire. If you've got specifics on those roles, then great. But if it's quite speculative, so for example, in the sector, we want to hire nurses, not sure how many, then we just set that out as well. So there used to be a requirement to carry out a resident labour market, which is basically you had to advertise the job in the UK for 28 days, and you had to evidence that, which was a real pain. To sort of, it was very strict on its criteria of how you evidence that. Thankfully, that's no longer going to be a requirement. So it does knock potentially 28 days off how long it takes to do the application. Even so, it is quite time consuming. And sort of it's something that I advise on fairly regularly. So we can help providers with that if they need it. So the cost for applying for a sponsor license it's £538 for a small employer. So that they class a small employer as an annual turnover of £10.2 million or less, or it's £1,476 for large employers. It then costs £199 to sponsor a migrant, each individual one. And there are some other fees involved, some of which the employer is responsible for paying, some of which the migrant needs to pay, such as the immigration surcharge and a health surcharge and sort of other bits and pieces like that. And then, so going on to your final question, the sponsor license, once granted, it lasts for 4 years, and then you need to renew and complete a new application after that 4-year period.
Okay, thank you for that. It sounds like it's quite a complicated process to get to grips with if it's something you're not used to dealing with.
Yeah, absolutely.
Yeah, I think members would definitely benefit from some assistance from yourselves for that. So that's good that that's available to them and that's something they can get. So
absolutely,
thank you.
Yeah, no problem.
On a slightly different subject, but one that also comes to mind is thinking about student visas and people that are in the UK studying. We sometimes employ people on these type of visas where they've got limits on how many hours they're allowed to work in term time, and then it's more flexible outside of term times. Yeah. Is that going to be affected by all of these changes?
Thankfully, no. The position is the same. So students that are following a full-time course at degree level or above, working under a student visa. So it's currently, well, it was called a Tier 4 visa, but it's being changed to student visa, which I think makes sense. But they can work 20 hours a week during term time and then full-time outside of term time, which is exactly the same as the current the current position.
And in the future, that would apply to everybody from outside of the UK, including the EU nationals, I presume.
Absolutely, yeah, yeah. It applies to everyone that's working under that visa. Yeah.
Okay, that's a bit of flexibility and a bit of hope for us. Thank you.
Yeah.
My final sort of comment, really, that I've got at the moment on hearing all of this. It's more of a question that I'm not expecting you to be able to answer, Mike, but it's for the government, I guess. It's just what is going to happen to our sector when there just aren't enough staff to fill all the vacancies from within the UK workforce?
Yeah, there's no real easy answer to that. I mean, we all know the sector's facing a workforce crisis, and the government, frankly, needs to make it easier for us to recruit, or for you guys to recruit from abroad. It needs to invest in getting more UK staff into the sector as well. I mean, potentially investment in technology is going to be key, because that may free up staff time and make it easier for, you know, sort of more efficient for organisations to run, you know, with less staff, or to at least have them having a bit more time on their hands. But yeah, unfortunately, there's no easy answer, and it's you know, keep campaigning and sort of raising the profile of all of this. But as I said previously, the migration committee that has advised on this, you know, and has said there is a significant shortage in the sector of vacancies, and we need to be addressing that now. The government has said, well, for now, no, we're not prepared to do that. So you know, it's just fingers crossed they do something about it before it becomes a you know, even worse issue.
Okay, thank you for that advice. I think one ray of light for us is, at least with what's happened with COVID and the recognition of social care staff as being caring heroes, has helped raise the profile to a degree amongst the UK. So yeah, hopefully that might, we can build on that. That might help us into the future.
Yeah, we can hope so.
Indeed, yeah.
Can I squeeze in just one last question, Mike? In terms of people applying for settled status, if they don't manage it by the end of June, I think the deadline you mentioned, what happens?
Great question. Short answer is we don't know yet. We know that there is that deadline in place, and that potentially after that they won't have a right to remain in the UK. How that's going to be managed, how that's going to be tracked, absolutely no idea at this stage. What even happens after the 30th of June, and sort of the rights of different, you know, sort of the different nationalities, so EEA nationals, we're not sure. Hopefully something is going to come out in the next few months. So obviously we will circulate any further information and updates as and when we get them. But at the moment we're just sort of waiting on the government to make decisions and to roll those out.
The message is just get it done before then.
I would say so, yeah. I mean, there's no, I mean, it doesn't take too long. Apparently the average time for approval is, once you've submitted an application, it takes about 4 to 8 days. It should take about a week. So, you know, if they get the application done, I don't think it takes too long. I mean, personally, I haven't sort of looked at the application itself. I know that there's, for example, there's an app you can download to where you take a photo of yourself and your passport or your ID document, and then that gets submitted for verification. So it's quite, you know, sort of tech savvy, and it seems like it's fairly straightforward. And then the application is all done online on the Home Office website. So I don't think it's too labour intensive. And then, yeah, as I said, it takes about a week to get a decision on that. So plenty of time, but I think at the same time, you know, get it done sooner rather than later, and then you've got nothing to worry about.
Thank you.
Okay, everybody, are we done with the questions?
Yeah, I think that's it. Yeah, thank you.
Thank you both. As somebody who has a few years ago gone through the process of applying for a sponsor license, all I can say is get help right at the beginning. We couldn't have done it without the help that we had. So I would commend people to get in touch with you at Royds Withy King if they're looking to embark on applying for a sponsor license. As to the workforce crisis, I think most of us on this call know that it's been there for about 10 years for the care sector. I can only hope that maybe some of the poor folk from retail with fantastic customer service skills might be looking with the right value set to come into care. But you know, we've needed to draw on foreign workers for so long. I just don't know. I'm very concerned about what the future holds, as I know we all are. Otherwise, we wouldn't be having this call. So thank you all. Thank you, Mike. As I say, you're from our commercial partner, Royds Withy King. If anybody would like to get in touch with you, they can do so direct or via David or me, and we can happily put you in contact. We're delighted to do that. Thank you for your time. We really appreciate it.
No problem at all.
And Rizwan for the questions. I'm sure that members watching this will be really grateful that you've put the questions forward that I'm sure are playing on their minds as well. So thank you all.